Welcome to Evidence Mastery with Dr. Masad Tusi. I am going to help you understand what multiple myeloma is and how it is managed. Please note that this video is for education only and will not replace your doctor's advice.
All right, let's dive into this important and complex topic. To make sense of it all, we've laid out a clear roadmap for our journey today. We're going to start with the absolute basics. What exactly multiple myeloma is. Then we'll get into the how it actually affects the body. From there, we'll cover how it's diagnosed, look at the really exciting modern treatment strategies, and finally, wrap up with the prognosis and the most important takeaways.
So first things first, what are we really talking about when we say multiple myeloma?
Fundamentally, this is a cancer of the immune system. We all have these cells called plasma cells in our bone marrow. Think of them as tiny factories that produce antibodies to fight off infections. Well, in multiple myeloma, these plasma cells go rogue. They start making endless copies of themselves, and they all turn out massive amounts of a single, useless type of antibody. And as they multiply, they can wreak havoc on the surrounding bone.
So who does this disease typically affect? The evidence paints a very clear picture. This is primarily a disease of older adults, with the median age of diagnosis right around 70 years old. We also see some very clear disparities. For reasons we're still working to understand, it's about twice as common in Black individuals compared to white individuals, and it affects slightly more men than women.
Now, to put that into perspective, the American Cancer Society estimates the lifetime risk for someone in the U.S. is about 1 in 132. So, while it's not one of the most common cancers, for the people and families it touches, its impact is absolutely significant.
Okay, so we know what it is. Now let's dig a little deeper into how these cancerous plasma cells actually cause so much damage inside the body. What is the mechanism here?
The key culprit, the signature villain in this story, is a molecule called the M protein. This is that abnormal, non-functional antibody that the myeloma cells produce in massive quantities. Detecting this M protein in the blood or urine is a central, hallmark feature of the diagnosis. And this M protein isn't one-size-fits-all. As this classic data from the Mayo Clinic shows, there are different flavors, if you will. About 55% of patients have what's called the IgG type. Another 20% have the IgA type. And a pretty significant portion, about 15 to 20%, produce only a fragment of the antibody, known as a light chain.
This is how that devastating bone damage happens. First, the myeloma cells form little tumors inside the bone marrow. Then, they release these chemical signals that basically trick the body's own bone demolition crew, cells called osteoclasts, into going into overdrive. This creates a huge imbalance. Bone gets broken down way faster than it can be rebuilt. And the result is these weakened areas, or lesions, that on an X-ray literally look like punched-out holes in the bone. These underlying processes lead to a classic set of clinical problems. Clinicians often remember them with the acronym CRAB. The C is for high calcium, which leaks out of the damaged bones. R is for renal or kidney problems, because those antibody light chains can clog up the kidney's filters. A is for anemia, as the cancerous cells crowd out the healthy red blood cell-making machinery in the bone marrow. And B is for the bone lesions themselves, which cause pain and fractures. On top of that, because the healthy plasma cells are suppressed, patients often suffer from recurrent infections.
So, given this whole constellation of symptoms, how do physicians put all the pieces of the puzzle together to arrive at a definitive diagnosis?
The diagnostic workup is a very logical, step-by-step process. It starts with a suspicion, maybe from persistent bone pain or some routine lab work that looks a bit off. That leads to specific blood and urine tests to hunt for that M protein. Then, advanced imaging like a PET scan or MRI is used to look for bone disease. And it all culminates in a bone marrow biopsy, which is the gold standard for confirming that, yes, more than 10% of the cells in the marrow are clonal plasma cells. One of the earliest and most fascinating clues can be seen just by looking at blood under a microscope. All of that extra M protein makes the blood thicker, causing the red blood cells to stick together and stack up like little rolls of coins. This is called rouleau formation, and it's a very strong hint that something is amiss. Once the diagnosis is confirmed, the next crucial step is staging. This helps us understand the prognosis. The modern standard is the Revised International Staging System, or RISS. It's quite sophisticated. It combines blood markers like beta-2 microglobulin with the specific genetic abnormalities found in the cancer cells themselves to categorize the disease into one of 3 stages.
Now we get to the most dynamic and, frankly, most hopeful part of this story, The counter-offensive. How do we treat multiple myeloma today?
The landscape of myeloma treatment has undergone a complete revolution. It's like night and day. We've moved from older, traditional chemotherapy, which had limited success and a lot of side effects, to sophisticated, multi-drug combinations that are much more targeted and effective and have just dramatically improved outcomes for patients.
The modern arsenal is deep and varied. We have drugs that block the cancer cell's protein disposal system. Those are proteasome inhibitors. We have agents that modulate the immune system. We have monoclonal antibodies that act like guided missiles to target the myeloma cells. And now, we're in the newest frontier of cellular therapies like CAR T cells and what are called bispecific antibodies, which are really changing the game.
Let's just pause for a moment on CAR T cell therapy because it is truly remarkable. This is a form of living medicine. We literally take a patient's own immune T cells out of their blood, genetically reprogram them in a lab to recognize a specific target on the myeloma cell, grow millions of these new supercharged cells, and then infuse them back into the patient. They become a powerful, targeted, living army against the cancer. It's just incredible science.
So, with this powerful new arsenal, what is the prognosis for patients diagnosed today? And what are the crucial points to remember from this whole discussion?
This is the crucial point, right here. The progress has been absolutely remarkable. Recent real-world evidence shows that the median overall survival for newly diagnosed patients has now surpassed 10 years. This means that while myeloma is still considered incurable, it's increasingly being managed as a chronic disease for many, many people. So, to summarize our key takeaways, myeloma is a plasma cell cancer that primarily damages bone and kidneys. The diagnosis relies on a combination of findings: the M protein, bone lesions, and too many plasma cells in the marrow. Treatment has been completely transformed by targeted drugs and immunotherapies. This has led to survival more than doubling in recent decades. And finally, managing the complications like anemia and bone health is a key part of comprehensive care. This incredible pace of innovation really just leaves us with a final, hopeful, forward-looking question. As we learn more about the biology of this disease and develop even smarter therapies, the future of myeloma care holds immense promise.
I hope you enjoyed this video. Please feel free to share your experience or questions in the comments. Please note that I won't answer personal questions. If you found this video helpful, don't forget to subscribe to my channel.